second. So today's speaker is Dr. Luma Munjy, who will be speaking about cognitive empathy, the key to developing healthcare providers. Before we begin, I would like to briefly share about Dr. Munjy. Dr. Munjy is an assistant professor in the School of Pharmacy, specializing in chronic disease management with an emphasis on diabetes management. Her clinical research interests are focused on improving management of diabetes, and her educational research interests are focused on enhancing soft skill sets in health professional students. So now, without further ado, please welcome Dr. Luma Munjy.
Good morning, everyone, and thank you for joining me today. It's great. I see a lot of familiar faces, a lot of my colleagues joining us, and then I know we're also recording this for parents who couldn't join us today. So I'd like to go ahead and get started, and I will share a little presentation that I've put together to kind of walk us through this topic. So give me a moment while I get that up. And then hopefully at the end, we can potentially talk about empathy as a group and discuss, what it means to each of us. Okay. So cognitive empathy. This is a topic that is very near and dear to my heart. It's something that over the past several years, I have been working on understanding because I was placed in a classroom about 4 years ago where I was asked to teach pharmacy students about end-of-life care. And that's not my specialty. And it was specifically for patients, geriatric patients at the end of life. So I brought in a chaplain who's worked internationally in different countries on developing empathy in providers so that when they deal with patients at these vulnerable stages at the end of life, they're prepared to deal with their emotions. And I brought him in to kind of help me guide this lesson for my students. And he said something really interesting. He said, your students are extremely intelligent, but I noticed that even though they're very close to one another, they're not showing each other that they care. And this is different from what I've experienced around the world. And so I thought, okay, that's strange. What is it about our students? And I was at another institution. What is it about our students that maybe this skill set isn't being highlighted? So when I dug into the literature, I found it wasn't particular to one student body. This is kind of a problem around our entire country where empathy is possibly declining. So COVID-19 really highlighted this for us. And I don't know about all of you, but 2020 was certainly a year where we as a whole, as a world, had to draw on our feelings and emotions and understanding what others are going through. And this picture really says a lot to me. These healthcare providers that are geared up completely, you can't see their faces, but their body language is saying it all, just distress and how do we deal with this emotionally. And at that point, you can be the smartest or most intelligent person in the world, and you can be a person who has great skill sets. But if you haven't tapped into your emotional capabilities, how would we have dealt with something like COVID-19? And we're still dealing with it. And then you think, okay, but what about how we deal with our patients? Because this certainly changed as well. I can tell you from my perspective, dealing with patients that have chronic diseases and going through that on a daily basis, but not being able to connect with them, that was challenging. But then add in the fact that in an area like a hospital, in an emergency department, we have these healthcare providers who are now substituting for family members. They're having to be the ones that not only care for them in terms of their health management, but they're also the ones who have to support them emotionally. I think as human beings, maybe we've been prepared for this to some degree, but we certainly weren't equipped with the skill set to go in and say, hey, let's imagine the worst case scenario in the world happening, and let's teach you how to deal with that. And then with our most vulnerable population, we look at our older adults and how this affected them. Suddenly they're completely isolated from their loved ones, and they have to be connected to them through technology. That's not an easy challenge. That's a challenge in and of itself. And then we move to our youngest individuals. What's going to happen to our, the kids in this generation? I don't know about all of you, but for me, if you were the only person sitting at a lunch table when you were in elementary school, that was not a good sign. It wasn't a good sign of you socializing. And now we're putting kids in this position. So what effect will that have on how they understand others and how they understand themselves? Will this in turn cause people to have a more individualistic mentality? And how will they be able to interact if it's a skill that they haven't practiced? So I'm painting a kind of grim picture, and that's not my goal, just prepping us for the idea that we probably have to do something moving forward. And this was an issue before, but after 2020, the issue has come to the forefront, especially in healthcare. So then what is empathy? It's a buzzword that I think we hear all the time, show empathy, show that you care about others. Is compassion the same as empathy? And one of the easiest ways to think about it is literally putting yourself in another person's position. That's kind of the simplest form, perspective taking and placing yourself in somebody else's shoes. But what do we do with that? Because that's really the next question is, great, I understand how you feel, but what do I do? So being in education, I like definitions. And so I need a definition to really have a tangible way of understanding a concept. So if you look at the definition of empathy, one, it's a noun. So person, place, or thing. In this case, not a person, not a place, so it's a thing. And it's the ability to understand and share the feelings of another. And that's helpful, I suppose, in understanding what empathy means because, okay, I understand and I can share, but it limits you. Being a noun, it just keeps you there. It's not a verb where we can take action on it. So I needed something that helped me understand empathy a little better. So another way to look at it is sensing emotions coupled with imagining what another is feeling. So now we're drawing in on our senses. We're saying take those emotions and feel them. Feel them with your senses and couple that with your imagination. Imagination is extraordinary, the places you can go with it. And putting these together will help you understand what another person is feeling. So this definition brought me closer to understanding what we need to do in terms of empathy education. And what it leads you to is something called perspective taking. This is a choice, and specifically, it's a cognitive choice of placing yourself in another person's position. And when you're in their position, you reflect actively on their perspective. Now, the reason why this is different than taking it to be a noun is you're doing it actively as a choice and you're putting yourself in their perspective so that you can take action. That leads us to cognitive empathy. This turns empathy into a verb, an action. And for me as an educator, when I think of this, I've taken something that's a little bit intangible and turned it into something that's an action that I can teach and assess, which is key. Because we can talk about empathy from now until, 2022. But if we don't have a means of making it tangible and something that we can actually have people do and understand how to do it, it might not mean much. So how about research and empathy? Because when I got to that point and I understood the definition, the next thing I wanted to do was say, what are people already doing out there? And is it something that we really, is it a deficiency, especially in our education systems? So Dr. Sarah Conrath is an associate professor in the Lilly Family School of Philanthropy in Indiana University, and she specializes in empathy and altruism research. And she has looked into some interesting information on our higher education systems and what's happening with our college students in terms of empathy. Specifically, we have this kind of the world revolves around me perspective that's coming up more often. We found that from 1979 to 2009, there's been a 40% decline in empathic concern and perspective taking seen amongst college students. More than that, 1980 or later, if you were born in 1980 or later, those individuals seem to have the lowest levels of empathy in comparison to all other individuals. And this was regardless of gender, level of education, ethnicity, using nationally validated surveys. And so all of those kind of reasons that we try to rationalize, like, well, maybe those people were not exposed to the same situations as others. Maybe their level of education was different. None of that mattered. It seemed that as we moved on, 1980 or later, this seemed to decline. More than that, there seemed to be a higher agreement with narcissistic patterns of behavior. And that is certainly concerning. So, in national surveys for those born in 1990 or later, when we administered questions from the Narcissistic Personality Inventory, which is a validated survey, we found that there was a higher likelihood of agreement with narcissistic patterns of behavior. For instance, statements like, I always know what I'm doing. If I ruled the world, it would be a better place, and I will never be satisfied until I get all that I deserve. More people seem to agree that with this statement if they were born in 1990 or later. Now, I'm not picking on anyone born in 1990 or later. This as a whole describes that our community, our society might be emphasizing different behaviors that are considered positive in comparison to previous generations. So this is a busy chart with all of this different research, but I want to highlight a couple of specific trends in association with that narcissistic personality as well as the decline in empathy. Specifically, what we've also seen is the percentage of American college students who have dismissing attachment styles have also been on the rise over time. So basically, not only are we developing this personality where we kind of have the me perspective, but we're also dismissing others and not attaching properly to them. Kind of saying, okay, that's great. I'm going to go focus on this. Dismissing people's feelings and how we attach to them. Additionally, when we look at moral and ethical decision making, we found that even if moral and ethical decisions have not changed, college students' justifications for their moral decisions have become increasingly self-centered. So when we've given validated questionnaires and surveys that have been used for decades that ask these questions about moral and ethical dilemmas and making a choice, would you do this or would you do this? The choices might not be that different from the past, but the rationale for why you make the choice is increasingly based off of how it serves yourself. So, okay, I've painted this picture of we don't have empathy. What are we going to do? But let's also talk about the positives. What happens when we are empathetic? What's the evidence show about embedding empathy into our lives? And specifically, for this talk, I'm going to talk about what it does to healthcare. Okay, so early research conducted at the University of Cambridge identified that doctors who display cognitive empathy have a lower rate of early death amongst their patients with type 2 diabetes. Now, anytime I look at a study that says we're changing the rate of mortality or death, I want to take a double take because I want to make sure that this study actually makes sense. So it's an early research. It's looking at kind of on a global scale, was there any changes in these physicians that were rated very high on the empathy scales by their patients? And it's not that hard to see that it's probably not the empathy itself, and this is what the researchers concluded, but likely the impact of what it does to their patients that made the difference. I don't know about you, but I know that if a physician or a provider approached me with kind of a cold and callous demeanor, I'm not very likely to listen to what they say. And it's very unlikely that I'm going to put a medication into my body when they're not showing me their concern and their care. So potentially, it's not just the empathy that made a difference here, but the fact that the empathy empowered patients to do what their physicians were asking them to do to begin with, like take your medications, follow these instructions, and change your lifestyle. All of these things that you're probably less likely to do if you don't feel that the person who's telling you to do it is invested in your care. All right, some more evidence. So there was a study conducted in Parma, Italy, with 20,961 participants. and they all had type 2 diabetes. They took their providers and they rated them, self-rated their empathy, and also had the patients, the participants, rate their provider's empathy. And they categorized them into 3 groups. They said providers with low empathy, medium empathy, and really high empathy. What do their outcomes look like? And in the world of healthcare, outcomes are everything. We want to know if you're doing something, is it changing patients' lives? Is it improving their health? Is it decreasing hospitalizations? Are we making a difference? Prove that. So when we looked at this study, providers with high empathy scores at the highest rating were linked to a 40% reduction in diabetes complications compared to those with medium and low empathy scores. Now, for me, being that my specialty is in chronic disease management and focusing on diabetic patients, this is huge because I can tell you that the amount of time that is spent working with a patient and convincing them to modify their life, not just for a day or a week, like, let's do a health challenge and lose 10 pounds in 3 months. No, change your life forever is quite difficult. And when they come to see me, being that I'm in pharmacy, their number one concern is, are you going to give me more drugs? And I don't want to be the person who has to do that unless I think it's really necessary. So to see that if you just show empathy and you can sit with a person and understand their perspective, that can reduce complications, that is pretty powerful, especially because it's free. And how often can we say that something is free and it can save lives? So the question becomes, why aren't we investing more in something that is so powerful, costs so little, and changes something so effectively? Okay, so now I'm going to go into education. I hope I've convinced you that this is important. And how do we get our graduates to this point? I love this picture because I think that all of us, or maybe myself, you feel like you're on top of the world when you graduate. You worked so hard, and it's kind of like, yep, I did this. It was me. Bernard Amadei, an Ashoka Fellow and founder of Engineers Without Borders, made a great statement. The education system forces people to unlearn the empathy they were born with. It's a system based on always seeming strong, contributing to the economy, and being number one. Being number one is the rule of game, and how we relate to others is fundamentally dismissed. It's a grand statement and maybe not entirely true in every education system. But I think the idea that we promote in our culture as a whole, globally, the idea of individual strength, individual contribution to our economy, to our society, and achieving this status of being number one might need to have some reflection. Perhaps it's not wrong to have those goals and ideals, but perhaps the way that we reflect on it is the issue. Maybe we need to remove the idea that I need to be strong, I need to contribute, and I need to be number one, and change that framework in our mind to say, when I am strong, this is what I can do for others. When I contribute, this is how it helps others. And when I work towards being number one, I bring society together to be number one. And that's really the goal of what empathy development should do. Okay, so let's focus on what we are doing because we do some things really well. When we look at education, we kind of have these 3 main categories. Cognitive skills, that's where we diagnose disease, we treat disease, we have all the science. Then we have the psychomotor skills, what we do with our hands, so performing a surgery, using a medical device, knowing how to give those vaccinations that we're all signing up for. Those are the psychomotor skills. And then we have another 3rd leg to the stool, the affective skills. We call those soft skill sets, and it involves feelings, emotions, and attitudes. And it's really imbalanced, not purposely, but because if you look at cognitive skills and psychomotor skills, they're really tangible, they're objective. I know how to teach them. I know what to do to assess them. I could give you a test and I could give everybody the same test and see how they do. But how do you assess a feeling? How can I go to somebody and say, you're not empathetic? That's a little bit hard, right? You got to make it consistent. So soft skills are just not as emphasized in the same way that cognitive and psychomotor skills are, even though our intention is to educate our students in all three of these domains. So then, what is education without the affective domain? I like to think of it as just information overload that turns into this black hole. It just sucks you into nothingness because you don't have any context to use that information, file it appropriately, and use it in the real world. I think we can all agree that you could have been the most intelligent person when COVID-19 hit. But if you didn't have the skills to manage the emotional aspect of it in that emergency department, in that intensive care unit, your intelligence might not have gotten that far. So what we want to avoid is this black hole of information. Okay, so I hope I've convinced you. Now the question is, how do we teach it? And I can promise you it's not going to be a chalkboard of graphs and formulas. It might be in some way, but not in the way we deliver it to our students. So how do you teach a feeling? That's really what my research focuses on, and the question that I've asked myself for well over 3-4 years. I want to pause because I've talked a lot and you might be getting tired of hearing my voice. And I want to show you a short clip from Brene Brown on the difference between empathy and sympathy, because this video really breaks down the core of how we can get into that mindset of perspective taking.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So I love that video because I think it breaks down this concept into such easy terminology, and it helps you build the framework of what we need to do to teach it. It's quite simple when we break it down. And that brings me to what I am doing with my colleagues at Chapman University School of Pharmacy. We have a great team that we're all working together to figure out how we can teach and assess empathy. And the first place we start is awareness of oneself, because you certainly cannot take the perspective of another person if you don't even know who you are. And I'd say this is probably the most challenging part of this process, is taking that microscope to your own brain and saying, why did I do that? What was my intention behind it? What am I feeling and why? And how do we do this in an active and healthy way? Reflections. You're going to hear me say reflections a lot because reflections are key here. We do reflections about what you're feeling. We also do reflections on reflections. So going back to a previous note that you wrote and saying, what was I thinking when I wrote that? Do I still feel that way? Why or why not? We role play. Put yourself in that position, play it out, feel it out. And a big part, narrative medicine. And all of these have been shown in the literature to improve this ability to be aware of yourself. Narrative medicine, I love this concept. What you're doing is, in medicine, we learn how to do this skill. We call it soap note writing, where we write out all of the issues that we see with the patient, and we find this very concise method of solving a problem. It's very effective and it's extremely important, but it can be very kind of bland in terms of emotions. And you need that. You need that to get your job done. But the flip side of it is adding a narrative when you're in school, taking that patient and putting the story behind it, individualize them so they're not just lab values and goals. And that's what we do to build awareness of yourself. Once you do that, you go to awareness of others, putting yourself in somebody else's shoes. This is where perspective taking starts. And to do that, we no longer want you to only reflect in your own mind. Now we're saying, okay, get out of your head, reflect with your team. This is especially important when you think about our current way that we're teaching. All of us are isolated behind our computers. Getting people into teams and telling them, reflect out loud. Have a team brain, not just a one brain. And then when you have that team, discuss it with the class, inter-team and intra-team discussions. And this is how you're going to consciously and subconsciously develop an awareness of others. And after you build those two skills, awareness of yourself and awareness of others, we can put you into practice. And that's when we go to experiential education and we say, great, you have the skills, now go practice them in real life. And we take our students and we put them into experiential education. And instead of just leaving them there with their experiences, we're going to bring them back and say, now tell us real patients that you saw and reflect on them, both your own personal reflection and then have your team reflect with you. Everybody who does this together is going to bring a unique patient case and a unique circumstance and a unique perspective. And we're adding to that ability to have that empathic response. And again, reflection. This is when they keep that, journal of reflections and they continuously watch themselves advance in their ability to understand themselves and others. And reflecting on previous reflections allows them to go back and say, wow, I wasn't really thinking that deeply. I've developed so many skills in my ability to understand myself, and they can watch that growth over time. And then in their last year, and this is kind of our future goal that we haven't got to yet, we put them into real practice. We don't just do it now in pharmacy, but we get interprofessional seminars going. We bring in palliative care physicians. We bring in pharmacists, social workers, psychologists, chaplains, people who have different perspectives, and we get the students to play those roles. And we have interprofessional teams weigh in on how you can deal with these situations and the emotions that are occurring within the group. Because an important part of empathy development is not only experiencing and feeling what another person feels, but understanding the right reaction. I mean, if we send our students out there and we're putting them in these really, really scary positions where they're just feeling a lot of pain and suffering from others, it could paralyze someone. It could definitely send you into a corner where you don't know how to react. So the last phase is giving these students the tools to know how to appropriately react and deal with the emotions that they're feeling when they've had this ability to gain empathy from others. And then we do the best part that all students love. We assess them. An assessment here is important because it's not about being punitive. It's not about finding a way to say, hey, you did something wrong. It's actually about tying it in with reflection and saying, hey, I noticed that you did this. Reflect on it and let's see how we can make it even better. So assessment is really going to be the key to tying up this entire process of empathy development. And what I like to think about is, if I were to summarize this process, is first semester, we've got Baby Yoda. That's how they enter. Last semester, they've gotten older, but they've gotten wiser. So if we can get them from first to last in this process, then I think we've done a good job with our empathy development. And I've talked a lot, and the way that I want to wrap up this talk is with a nice quote from somebody who's really smart. We'll go with Aristotle. Educating the mind without educating the heart is no education at all. And the goal is to put the heart back into education. So with that, I will stop my screen share and just say thank you to everybody for joining me today and for listening to my talk. I'm under the 1 hour mark, but I'm happy to stay and engage with everybody and share in a discussion on this process of empathy development. And if not, I think we can also let everyone have more time in their day.